When a hospital chooses to evolve, everything changes. Not just the outcomes, but the culture, the people, and the possibilities. At San Antonio Behavioral Healthcare Hospital, this evolution began in February of 2024, when our new CEO brought forward a clear message.
Quality care and safety first.
And a culture built on attention and accountability. She saw what many did not, the potential of this hospital and the responsibility we carry for the thousands of patients and families who walk through our doors every year. And with that, a decision was made. We were going to do things differently because our patients deserved better, and so did our staff. When this journey began, we faced many challenges, where morale was the most significant. Culturally, staff carried the weight of years without a standout vision where not only patients, but staff also came first. But leadership made a conscious choice to change. We offered our staff stability and structure, our patients safety and innovation, and our community collaboration and service. We committed to rebuilding from the inside out. We began by raising the clinical standard across every unit. We implemented acceptance and commitment therapy, ACT, hospital-wide, a rare accomplishment for any behavioral health facility. We redesigned caseloads so clinicians could provide more meaningful, individualized care. We rebuilt unit programming from scratch, ensuring every patient receives structured therapeutic activity. No more idle time for patients on the unit. We launched 3 all-staff clinical trainings, something almost unheard of in any acute psychiatric setting. It focused on trauma-informed care and safety, and the results were tangible. Our children's census increased by 12%, reflecting restored trust and improved care. Safety became a non-negotiable. We strengthened enforcement of policies hospital-wide. We launched our Clean campaign and Safety First campaign, reinforced during our energetic staff-wide pep rally that combined education, fun, and culture building. We enhanced de-escalation practices through evidence-based menu management strategies to include PACE and therapeutic options. We improved discharge planning to safeguard continuity of care. Today, safety is no longer a priority. It is who we are. One of the greatest transformations happened internally within our people. We embraced a new cultural philosophy with a shared commitment to our new cultural belief statements. Above the line. This is a culture of accountability, professionalism, and empathy. A culture that attracts the right people and retains them. We overhauled orientation to give new staff a strong foundation in mental health education, emotional intelligence, trauma-informed care, and our above-the-line culture. We launched a leadership emotional intelligence training for our new managers and directors with individualized professional development plans and peer-to-peer processing sessions that strengthened our communication and restored trust. We integrated holistic huddles, offering our staff space for mindfulness and grounding, because a regulated staff creates a safer hospital. We opened our Give a Buck store to recognize service excellence and celebrate staff in meaningful ways, shifting to a culture of positive reinforcement. We completed our first year with an end-of-year celebration at a formal venue where staff enjoyed music, food, raffle prizes, and recognition among their peers and leadership. The turnout was larger than expected, with staff dressed to impress and enthusiastically sharing memories of the event for weeks to come. We invested in our people, and now they invested in our patients and our hospital as a whole. Just 1 year ago, our presence in the community was minimal. Today, we are the hospital everyone wants to partner with because we choose to lead with our heart and serve with compassion. Our CEO began by attending our community Meeting of the Minds, a monthly meeting hosted by SABH where community partners come together to share resources and introduce their services. The gathering was small, yet she spoke with passion and purpose, confident that this small gathering would be the beginning of building trust through transparency. We expanded our business development into a servant leadership model, focused on listening first and serving second. We reconnected with former partners and built new ones by offering ourselves as subject matter experts in behavioral health. We provided dozens of community trainings on burnout, youth mental health, communication, crisis response, and trauma-informed care. Just a year later, our Elevate and Educate Back to School Fair drew over 70 organizations to our campus, a record for our hospital, with 700 families receiving backpacks, over 100 families enrolled in Medicaid and other insurance supports, and TechStock installing over 50 free car seats to families in need. When Kerrville faced devastating floods, we mobilized quickly, partnering with organizations and community members to bring support and resources. We began appearing in major news outlets, offering not just information about services, but practical education on mental health for the public. For the first time, school systems actively sought us out. What was once a challenge for SABH became our strongest market. We now provide staff training for districts seeking to reduce educator burnout and student behavioral incidences. We were asked to present at legislative summits on school mental health. We became partners in grant-funded initiatives for school staff mental health trainings. We launched telehealth crisis assessments, a revolutionary strategy for students to be safely evaluated at school, reducing unnecessary emergency detentions to preserve their dignity, improve engagement in treatment upon arrival through voluntary admissions, and close the loop of communication gaps between the school system and our hospital. We added PHP transportation services, eliminating this critical barrier for patients needing access to this level of care. We also held focus groups and listening sessions, conversations with CAM, for our staff to have access to our CEO to provide feedback, suggestions for improvement, and innovative ideas for patient care and staff morale. Our staff feels seen, heard, understood, and empowered to take part in every single initiative that our hospital has launched. We are no longer just a hospital. We are a trusted community pillar and resource. Then came one of our most visionary achievements, a vision that has been years in the making, now finally real. Key Charter San Antonio, located right here on our campus, the first fully integrated model in our city where students in PHP and acute care can receive mental health treatment, accredited education, therapeutic support, academic continuity, all in one place. For the first time, a child in crisis doesn't have to choose between getting help and staying in school. This partnership builds identity, confidence, and stability for students, prevents academic regression during treatment, offers hope to families, supports schools in meeting mental health needs, and positions SABH as one of the most forward-thinking behavioral health hospitals in Texas. This is more than a program. This is a lifeline and a bold step forward towards redefining what comprehensive care truly looks like. At SABH, our vision is clear: elevate, empower, heal. We are elevating the standard of care. We are empowering staff with competence and confidence. We are healing our organization so that we can heal our community. And we are only at the beginning. Regardless of what happens in the background, the message is the same. This hospital is ascending. This team is aligned. This community believes in us, and our potential is extraordinary. In just 1 year, we have strengthened safety, rebuilt programming, elevated clinical practice, restored trust, expanded community impact, revolutionized school-based partnerships, and made history through integrative education and mental health care. We have demonstrated not only the value of this hospital, but the future we are capable of creating. At San Antonio Behavioral Healthcare Hospital, we choose to elevate. We choose to empower. We choose to heal. Because when we evolve, our patients evolve. When we strengthen our culture, our outcomes strengthen. And when we lead boldly, our community thrives. This is the evolution of SABH, and this is only the beginning.